Hello and welcome to this channel. In this video, we will talk about abdominal pain in pregnancy. We will talk about the most common causes, the most dangerous causes, and the different types of abdominal pain in pregnancy. We will also talk about how we can assess a pregnant patient with abdominal pain. What are the most common causes of abdominal pain in pregnancy? One of the most common causes is round ligament pain. The round ligament connects to the cornu of the uterus on the superior aspect and to the labia majora on the inferior aspect. So basically, it holds the uterus in place. As the uterus expands during pregnancy, this ligament is stretched. Round ligament pain is typically a sharp stabbing pain on one or both sides of the abdomen. It is most common in the second trimester, but it can occur at any time during pregnancy. Constipation. Constipation is a common problem during pregnancy due to changes in hormones, compression of the intestines by the growing uterus, and changes in diet. It can cause abdominal pain, bloating, and gas. Gas is another common problem during pregnancy. Also, gas can cause abdominal pain, bloating, and discomfort. Pregnancy-induced heartburn. This is caused by the increased production of stomach acid during pregnancy. It can cause heartburn, which can feel like burning pain in the chest or throat. What are the scary causes that we should keep in mind for abdominal pain in pregnancy? Ectopic pregnancy. This is a pregnancy that occurs outside of the uterus, usually in one of the fallopian tubes. It can cause severe abdominal pain, bleeding, and dizziness. If you want to know more about ectopic pregnancy, you can see our video in the gynecology playlist. Miscarriage. This is the loss of a pregnancy before 20 weeks gestation. It can cause abdominal pain, bleeding, and cramping. Preterm labor. This is the onset of labor before 37 weeks gestation. It can cause abdominal pain, cramping, and contractions. If you want to know more about preterm labor, you can see our video in the gynecology playlist. Placental abruption. This is a condition in which the placenta separates from the wall of the uterus before the baby is born. It can cause severe abdominal pain, bleeding, and cramping. Also, on placental abruption, we have a separate video in the gynecology playlist. And preeclampsia. Preeclampsia is a serious condition that can develop in pregnant women after 20 weeks of gestation. It can cause hypertension, proteinuria, and edema. If you want to know more about preeclampsia and eclampsia, we have a separate video in the gynecology playlist. What different types of abdominal pain in pregnancy are there? There can be obstetric and gynecological causes. Also surgical causes, causes related to the field of internal medicine, or musculoskeletal causes. Let's explore the different types a little bit more detailed. Causes for obstetric abdominal pain in pregnancy are directly related to pregnancy. Those are things as labor pain, preeclampsia, or the HELP syndrome, or placental abruption. To all of those topics, we have separate videos in the gynecology playlist. In preeclampsia, the pain is most commonly in the epigastric or right upper quadrant area, while in placental abruption, the pain is more typically felt in the back. However, the pain might be felt in different areas, depending on where in the uterus the placenta lies. Another cause is uterine rupture. Here the uterus basically tears, which leads to constant pain, fetal distress, shock, and vaginal bleeding. This usually occurs in the time of labor in a woman who had a previous cesarean section. Another possible obstetric cause is acute fatty liver of pregnancy. It usually occurs during the third trimester, and the patient complains of abdominal pain, nausea, vomiting, and malaise. Also often the patient experiences a yellowing of the skin and sclera, so jaundice. Let me know in the comments if you would like me to make a video about acute fatty liver of pregnancy. Let's now talk about the gynecological causes. This includes ectopic pregnancy, in which abdominal pain occurs usually between the 5th and 9th week of gestation. Symptoms include syncope, diarrhea, vomiting, and adnexal tenderness, so a dull pain that is felt in the lower lateral aspect of the abdomen. The patient might mistake a vaginal bleeding due to an ectopic pregnancy with a normal menstruation. Other causes are miscarriage, ovarian cyst rupture, fibroids, or an ovarian torsion. Also about all of those topics we have separate videos in the gynecology playlist. What do I mean with surgical causes? Surgical causes are all those that when you see them in the ER, you refer them to a general surgeon, which likely will quickly intervene in most cases. That includes an acute appendicitis, cholecystitis, intestinal obstruction, peritonitis, abdominal trauma, Meckel's diverticulitis, acute pancreatitis, and others. Important to keep in mind is that in an acute appendicitis after the first trimester, the pain may be located higher up, or we usually suspect the liver. Also, back pain or flank pain are possible, as with the growing of the uterus, all the other organs are moved around in the abdominal cavity. Now let's talk about the internal medicine causes. That's the largest group of causes and includes a UTI with or without pyelonephritis, constipation, diabetic ketoacidosis, sickle cell anemia crisis, lower lobe pneumonia, deep vein thrombosis, myocardial infarction, gastroenteritis, traveler's diarrhea, irritable bowel syndrome, and many more. And the last big group is musculoskeletal causes. This includes round ligament pain due to the uterus pulling on the ligament, general aches due to uterine enlargement, rectus muscle hematoma due to rupture of the lower epigastric vessels, and pelvic girdle pain due to symphysis pubis separation. How do I examine a pregnant patient with abdominal pain? After taking a detailed history and general physical exam, we should always make an ultrasound. We can use ultrasound to visualize the fetus, placenta, and other pelvic and abdominal organs. Ultrasound can also be used to detect abnormalities, such as ectopic pregnancy, miscarriage, and placental abruption. We can also take blood tests for the different organ-specific indicators, markers of inflammation, and other important values. Important to ask for or to check in the case of a pregnant patient is also vaginal discharge or bleeding. Vaginal bleeding during pregnancy could potentially indicate that there might be something wrong. So we want to make sure to ask the patient if she has experienced that lately. That's it for this video. I hope it was helpful. Thank you for watching. If you like our channel, please subscribe. And hopefully see you again in the next video.